Was loud. Hello, my name is Alyssa Cummings, and this is my physical assessment for eyes, ears, nose, and mouth. Okay, so we already did the visual acuity using the Snellen chart and the near vision using the Rosenbell chart, which I used a newspaper in order to conduct that. So first we're going to check out the inner campus of the eye all the way to the outer campus of the eye. So from here to here, we're just going to notice that on both sides of the eye it is symmetrical. Eyelashes are long and healthy. He has blue eyes, eyebrows are intact and no drainage, redness, itching, or dryness. Alright, so now we're going to look at both the eyelids, the top eyelid and the bottom eyelid. We notice that there is no lacerations and no signs of irritation. Now we're going to look at the sclera, or the white part of the eye. We notice that both sides are equally white, with no redness, drainage, itching, or signs of contamination. Now I put on gloves for this next part to check the lacrimal ducts for drainage. So we just push down right here and notice that no drainage comes out, which is good. And then we're going to check the eyes. Unfortunately my pen light's at work, so we're going to make do with a flashlight. So we're just going to start by having our client look straight ahead, and I'm just going to flash this flashlight in your eye and see how your eyes react. Okay, so his eyes are Perla. Their pupils are equal, round, and reactive to light and accommodate, which is exactly what we need them to do. Next we're going to check our muscle balance by having our client follow our finger. So what I'm going to have you do is I'm going to have you follow my finger, go up and down and side to side. So your eyes followed me parallel, which is perfect. That's exactly what we need. And neither of his eyes lagged behind or were lazy. So next we're actually not going to do this, but we would check the corneal reflexes with a cotton tip applicator to the eye to see if both eyes shut at the same time. A healthy adult or healthy child, both her eyelids will shut at the same time because it's a little painful. And then we're going to check the peripheral vision. So I'm going to give you this pad of paper. You're going to put it up to one of your eyes. Alright, and I'm going to move my hand up and down, and you're going to tell me when you can see my hand, okay?
Okay. I can see your hand.
Okay, and I'm going to come this way.
I can see your hand.
Okay, this way.
And I can see your hand.
Okay, and then this way.
And
Hey, no looking.
I can see your hand.
Okay. So that concludes our eye exam. Next we are going to look at the ears. So I'm just going to have you look at me real quick. And I'm going to notice that they're both symmetrical. The outer campus to the top of his ear, or the top of his auricle, is straight line, which is perfect. That's exactly what we need. I'm just going to tug on your ear a little bit and tell me if there's any pain or tenderness.
Nope.
Do you feel any pain or tenderness back here?
No.
No. Fantastic. Okay. And his ears are 4 to 10 centimeters away from his head, which is perfect. That's exactly where they need to be. Okay. Excuse me. So if I had an otoscope, next I would look inside of his ears by pulling up and back. I'd place the otoscope no more than a centimeter into his ear and be able to look at his hair, his cannulas, and his tympanic membrane. You definitely want to see hair in his ears because it helps with earwax and infections, and also with equilibrium. And then with the canals, you want to make sure that they're pink and healthy with no lesions, no spots, no irritation. And then his tympanic membrane, you would want to make sure it was like a pearly gray or a silver color. And then after removing the otoscope from the client's ear, you would ask them if they had any tenderness or pain, and hopefully the answer would be no. So next what I'm going to do is I'm going to kind of test your hearing. So we're going to do the whisper test. So what I'm going to ask you to do is I'm going to ask you to occlude one of your ears. I would stand 2 feet away from the client. Can you actually occlude your right ear for me? Thank you. So I'm going to stand at least 2 feet away from the client. I'm going to put a hand over my mouth, and I'm going to whisper 3 words, and I'm going to see if the client can tell me what words I whispered.
Dog, cat, pig.
Perfect. You got 100% on the whisper test. And next, if I had a tuning fork, we would use the tuning fork I would hit the tuning fork against my hand, and I would explain to the client that I'm going to hold it on top of your head to see if hearing is equal in both the left and the right ear, or if he can hear more in the left or in the right. After that, I would then test his bone conduction and ear conduction by using the tuning fork again. I would activate the tuning fork and place it right behind the ear on this bone. I would ask the client to then tell me when he could no longer hear the tuning fork, and then when he couldn't, I would move it to the front of his ear and ask him to tell me then too. Basically, you just want to see the amount of time that it takes the client to no longer hear the tuning fork. So next we're just going to take a look at your nose. So we notice that it's in the midline of his face, which is great. And I'm going to just test right here. Do you feel any tenderness or pain?
No.
No? Perfect. So I also don't notice any tenderness or nasal flaring, which is good. We don't want any of that. So I'm also going to use this flashlight again to just look up your nostrils. Okay. So I do notice that you have basal hair, which is perfect. They're pink, they're moist, and there's no contaminations, no sign of irritation or bleeding. And is there any pain?
No.
No. Okay. So next what we're going to do is we're going to test for patency. So I'm going to ask my client to just occlude one of your nostrils and blow through your nose. Perfect. And can you do it with the other side as well? Perfect. So bilateral nostrils are patent. And after checking the patency of the nose, we're going to test the sinuses. So I'm going to look at the peripheral sinuses, and then I'm going to look at the maxillary sinuses. The peripheral sinuses are right here, and I'm going to ask the client if he feels any pain or tenderness when flushing.
Nope.
Okay. And then the maxillary sinuses, do you feel any pain or tenderness?
No.
No. Okay, good. After testing the sinuses, we're then going to look and try and transilluminate the sinuses. So the peripheral sinuses are actually air-filled. So when checking them, you should just see a red glow. You should almost be able to see the light kind of transilluminate inside of them. And then when checking the maxillary sinuses, the light should shine through the cheek and into the mouth. So let's try that now. Okay, so I'm just gonna, so there is some redness there that I can see, and then I'm just gonna have you open your mouth for me. Perfect. Okay, so his sinuses were red, where you could see through them, so that's exactly what we want to see. Finally, we're going to take a look at the patient's mouth. Before the patient opens his mouth at all, we're going to notice his lips. They're not chapped. He actually takes very good care of them. There's no redness, no dryness, and no cracking. So now I'm going to have you kind of make like a smile face. Alright, so next we're going to take a look at his teeth. Now, I know that he's had braces, but you would look at his teeth and make sure that they're straight if he had an overbite, and then you would take a look at his gums. So his gums are nice and pink, and they look healthy, and they don't adhere to his teeth, which is perfect. We would also notice that he has had dental work done before, something to take a note of, and then we would have the patient open up your mouth for me and say ah with your tongue out. Perfect. We notice that his uvula is nice and pink, and that his he still has his tonsils. Can you stick your tongue out for me one more time? Awesome. So your tongue is midline, which is exactly where it needs to be. And then what we're going to take a look at is our hard and soft palate. Hard palate and then soft palate. Awesome. So no lesions, no redness. They both look pink and they're moist, well taken care of. His teeth are also in good repair. And then I'm going to have you put the tongue to the roof of your mouth. Okay, awesome. And then the final thing that we would do is take a look at the side of his mouth to make sure that there's no lesions to worry about. So go ahead and stick out your tongue for me. Perfect. And that concludes my video.